And why this is so important, I think, for PT practice is because the science on mindfulness is not that you have to sit for 40 minutes, in a cross-legged position and chant for hours on end. That really just somewhere between 3 and 10 minutes is where we see like the cognitive changes start to happen on functional MRIs, and where, like inflammatory markers in the blood change. All that happens probably somewhere around 9 minutes. So that can fit really easily into a PT practice, and it can definitely fit really easily into your life.
All right. Welcome. Thank you again. I'm glad we can make this happen. I appreciate your flexibility earlier today, so we can finally get this going. I've been really excited about this conversation, but before we dive in, why don't you give the listeners a background on kind of your history, maybe in PT and private practice, but then also getting into pain science and that approach.
Sure. Thanks, Jarod. It's great to be here with you. So I've been a physical therapist for about 25 years, graduated from school in 1996. So I'll give you my brief resume. And first job I worked in an inpatient adult rehabilitation center with had a focus on chronic pain. So I was there for about 2 years, multidisciplinary, worked with many other professionals, got a really good base under me on what both the inpatient as well as outpatient, because there was actually an outpatient part of that as well. So had my foot both in inpatient as well as outpatient during that 2-year experience. Then I transitioned to working in an outpatient private practice. I'm based in New York City, so this private practice focused pretty much solely on performers. So ballet dancers, Broadway performers, acrobats, some professional athletes actually as well. Did that for about 2 years. Focused, a lot on that population. But it continued to see like the average orthopedic and sports, condition in that practice as well. And then I got together with a couple of physical therapists in 2000, and we opened up a private practice. So that was in August of 2000. Just the three of us started out, no receptionist, no biller, just us, so to speak. We actually started it in the basement of a building, which kind of probably sounds strange to people in New York City, but New York City rents are extremely expensive. So we were looking for ways to keep our costs down. There was a new building that was built, a smaller, like kind of brownstone building. And it was kind of unique where the basement of the building was not only under the building itself, but actually stretched out behind the building. So almost like under a backyard, and had these big, huge skylights. So even though we were in a basement, we had like this wonderful light that came down, and it was probably about a 2,000 square foot space. And it was a nice place to, get our feet wet and kind of dig our heels in and start with, a physical therapy practice. And right from the get-go, we had more of a wellness perspective. So we provided traditional physical therapy. And we also, one of my partners did pediatrics. At that time, I was very involved still with the performing arts community. So I was not only treating patients, but I was also doing some more like personal training, condition work, if you will. A little personal training mixed in with a little Pilates, because I learned Pilates as a method of rehabilitation for performing artists. So we had a mix of traditional physical therapy and, I guess you could say, personal training, so to speak. And then from there, we expanded it. We decided, okay, the first one's up and running. It's going well. We're not stressing ourselves out, and there's money in our pocket. The balance sheet is black, which is good. So we said, okay, how can we look at this as a model? And then how can we duplicate this model and open up another one? And that's what we did with the second one. And then we did a third one, kind of the same way. At this pace, pace, I would say by the third one, we're all cash-based at that point. So just cash-based physical therapy.
And were you kind of dropping contracts as you went through that time frame, or did you start out mostly cash pay?
Yeah, we started out just cash-based.
Okay.
We were probably one of the first cash-based physical therapy practices in New York City at the time, which is 2000. There was a couple others around before us, but our reputation grew quite rapidly, I would say, in New York City for providing a different model of care, if you will, with regard to physical therapy and rehabilitation. And because we had that kind of model where you can come in with your injury and then continue on to, being well, people, of course, started with us when they're injured, but they kind of stuck around as well. So it was a nice way to build both aspects of that. I don't want to spend the whole episode on this, but the moral of the story is we grew that to about 15 clinics, not all cash-based. We had a mix at that point of cash and insurance. Some contracts we did not take, and we just did cash-based services. Some contracts we accepted, and then we had lots of programs that we developed if someone's insurance, let's say, ran out or expired, or whatever the term is you want to use where you live with regard to your insurance. So I exited that practice in 2015. Took just a tiny bit of time off and realized I'm too young and I don't like time off. I actually like to be busy, and I like to be working on projects that are important and meaningful. And I think definitely the work all of us do as physical therapists is important and meaningful. But I wrote a book at that point. I went to a major New York City publisher and I said, hey, I have an idea about this book. This is before the opioid epidemic started. So right around 2015, I said, hey, I've been reading the literature and the data and looking at things. And I really think that this is kind of like, the next big thing in healthcare, so to speak. And they kind of, weren't sure, like, as we know as professionals, people don't understand pain. They don't understand what it is. They don't understand how to treat it. They think, we just treat it with medication or surgery. Interestingly enough, the editor who picked up my book was actually a patient in physical therapy at the time, receiving physical therapy for a rotator cuff repair. So he had some idea of what physical therapy was, but I really approached this with, you have kind of more of an acute injury. It's not chronic. I'm talking about chronic pain and the multiple comorbidities that exist with it, what that impact is on the health of our society, as well as the financial health of our society, and how do we treat that effectively? Because those systems are really missing from really any healthcare system globally, but especially in the United States, where we have such an emphasis on medication, surgery, and injections with regard to pain. So that kind of takes you to today, where I founded a company called the Integrative Pain Science Institute. And my aim there is to educate both the public as well as practitioners about integrative pain care, which is the best evidence with regard to helping people reverse chronic pain. And I have courses there that professionals can take on various different types of topics with regard to integrative pain care, some of which we'll probably talk about today.
When you say integrative pain care, give a little more of a broad, or I guess detailed definition of what you mean by that.
Yeah, so if you go into the literature and you look at all the various techniques, methods, strategies with regard to pain. So if you look at exercise, if you look at nutrition, if you look at mindfulness, right? So just those three right there. There are many other interventions. And I'm really, when I say interventions, I'm primarily focusing on active coping strategies, so not the passive ones. So not things like a hot pack, not ultrasound, not acupuncture, really the more active coping strategies. When you look at them delivered in a single paradigm, so just exercise, let's say, or just mindfulness, people get positive outcomes, but they're minimal. And minimal outcomes, in essence, look good in a clinical study, but when you translate that to clinical practice, oftentimes it doesn't translate to meaningful, impactful outcomes for someone's physical function. And we've done a good job at, I think, looking at all these interventions in a way of delivering them, just one single intervention. Really, what I started out with that book way back in 2015, and really all the work I'm doing today, is just bringing awareness to the concept that, yes, chronic pain is complex, but we actually know when we combine more than one intervention together, that then we can take our outcomes from minimal to hopefully moderate or maximal and help people, overcome pain. Now, we do have inpatient pain rehabilitation programs that approach this from the perspective of having PTs and OTs and nurses and psychologists and social workers and physicians, et cetera. And they're important, and we need those, and we need more of them in the US. However, the reason why we don't have them is because insurance companies understand that that type of care is extremely expensive to deliver. So to admit someone to an inpatient, 4 to 8 week experience where there are multiple practitioners in an inpatient hospital setting is very expensive, and most of our private insurance companies don't have a forward-thinking, prevention-based view toward things. So my view in this, okay, this is a big problem that we need to fix, not only because we are professionals involved in treating chronic pain, but as citizens of our country that we live in the United States, we contribute to our healthcare. We contribute to our private health insurance. We contribute to Medicare and Medicaid. And if we don't treat them as well as workers' comp and disability and things like that, so if we don't find a way to solve this, really human condition of pain and suffering, if you will, in our country, then what are we left with? We're left with a country where people are suffering and they're in pain. They're not productive members of society. They struggle with distress, anxiety, depression, all the different types of psychosocial variables that are important that people are starting to talk about more and more. And of course, physical disability. Now, when I look at that and I step back and I say, okay, if inpatient rehabilitation multidisciplinary centers are expensive, and we probably won't, we'll see more open up, but not the way we need, because there's probably about, I believe the correct stat, which was in the Journal of Orthopedic and Sports Physical Therapy a couple of years ago, was that there's one integrative pain clinic or center for every million American that has chronic pain.
Wow.
Yeah, so we don't have enough. So I look at the physical therapy profession as really positioned to be in a kind of a right position to deliver integrative care in many ways. Now, some of us have already done that starting out many, many years ago. And then, others are learning, okay, how do I learn about nutrition and implement that into my practice? How do I learn about mindfulness or different types of cognitive behavioral therapies and implement that in with physical activity? How do I implement effective pain education in with all of this? So really, when you bring all this together, you have what's called integrative pain care, and your outcomes are better, which is ultimately what we all want for lots of different reasons.
So do you feel like, as a solution to these really expensive approaches that probably are not going to ever be fully supported as to the level they need to be by insurance companies, do you feel like the things that you're teaching, you've learned through the years and you're teaching, combined together can be delivered as a much more affordable solution, and also has kind of all the components needed for most cases of chronic pain? Or are there other kind of things outside of the therapies, the cognitive behavioral therapy, mindfulness, the physical activity? Are there other components that are still like a piece of that puzzle that you consistently think need to be a part of the approach or the solution?
I mean, the research behind what helps chronic pain with regard to all the things that we're talking about is pretty clear. And there's three main factors: pain education. So someone understands, okay, what is happening with me and what does this really mean? Because there's a lot of confusion around what chronic pain is.
Right.
So a lot of the research around the reconceptualization of pain has focused on that. So some pain education first. The second is some type of cognitive behavioral intervention. There are many types of them. As long as you're using some type of cognitive behavioral intervention to guide your treatment, then that's positive, that's beneficial. The reason why that's important is because there's a lot of behavior change that's required to overcome chronic pain. So these are patients.
Cognitive behavioral intervention. What's an example of that? I mean,
Traditional cognitive behavioral therapy is an example. Acceptance and commitment therapy is an example. Mindfulness, depending on how it's delivered, can be considered, under that umbrella. So those are the three main ones. Mindfulness is interesting because it's been adopted by the psychology professionals and literature, but it doesn't fit the box of a true cognitive behavioral therapy unless you deliver it in that way. And we can talk about some of that later on.
Yeah.
And then the third is some type of lifestyle intervention. The two lifestyle interventions that are most important for people with pain, there's three actually, but the two that are most important is some type of exercise or physical activity engagement, and then nutrition. And if you ask me personally, based on the literature, I would say exercise and physical activity is probably more important than nutrition for a large percent of the patients, unless you're dealing with someone who has a significant metabolic syndrome combined with an autoimmune condition, then you have to look toward nutrition to modulate what's happening there on a metabolic level. But those three right there, so pain education, cognitive behavioral therapy, and the promotion of physical activity are the three highest that when those are combined together, we have the best outcomes.
Okay, very good. This is something that I've been seeing be mentioned, and I've seen it, whether it's on blogs or social or whatever, pain science and the involvement of physical therapists in that, which is obviously so important, has really been on the rise. At the same time, it's not something that I've really had the time to put a lot of focus in. So I'm kind of even though I've been in the field a long time, when it comes to this stuff and the actual data, I'm kind of a newbie, which is probably good for this conversation, just because I'm asking the same questions that others would be asking. So, and the reason I asked about the behavioral cognitive therapy is my wife's a counselor. And so I hear her say that all the time, but I never really understood. I still don't know like the specifics of like, what are we talking about? Like a kind of a counseling session, and then you're guiding them to think in a different way, or let's dive down into that part a little bit more.
Yeah, and just so let's clarify that question a little bit, Jarod. So you're asking me perhaps the distinction between pain education versus, let's say, a cognitive behavioral therapy intervention?
Kind of, yeah, or maybe just more examples of how does a behavioral cognitive therapy play out in an actual session with you, say.
So let's make the distinction first. So pain education is essentially delivering education or information to someone about their condition, what the cause of it is, and what they can do to overcome it.
Okay.
Pain education is vitally important. I'm a big proponent of it. Things like Explain Pain and pain neuroscience education. I actually just interviewed Adrian Lowe on my podcast about a week ago, and we were talking about these topics. And the research on pain education is solid and it continues to grow. But pain education really only has an impact on two aspects. The first is fear of pain, and the second is pain catastrophizing. So negative thoughts or negative thinking about pain. Those are important, but again, just delivered as a single session of pain education or pain neuroscience education, the outcomes are minimal. And when they're minimal, that means not much is going to change. And ultimately, and this is even what Adrian Lowe said, is that we don't see a whole lot of behavior change happen with just pain education.
Mm-hmm.
So we need something else kind of I look at like turbocharge kind of everything else we're doing. And that's where cognitive behavioral therapy comes in. So you can, like as I mentioned before, you can use traditional cognitive behavioral therapy. You can use acceptance and commitment therapy, which is my preferred, or you can use mindfulness as well, which has aspects of it. But ultimately what you're doing is you're helping people build awareness around the idea that they have thoughts, and those thoughts have an impact on the physiology of the body, meaning how they feel. And those thoughts also have an impact on the things they do, or their behavior in essence. So that's where some type of cognitive behavioral intervention or skills training or strategies implemented with traditional physical therapy treatment is important.
Okay, that helps clarify. And the book that you're launching, probably right around the time that this will go live in the very beginning of 2021, is that focused primarily on mindfulness, strategies, or is it broader than that?
It's a little bit broader. So I look at my book like an ice cream sundae. So the kind of the base of the ice cream sundae is acceptance and commitment therapy. The reason why is because it probably has the most evidence, or the most encouraging evidence, with regard to helping people change behavior when they're living with chronic pain and other types of challenges. Part of ACT is mindfulness. So ACT is a mindfulness-based cognitive behavioral intervention. So if the base of the sundae is the ice cream is ACT, a little bit of the whipped cream on top is mindfulness, and then the cherry on top is pain education. So to break that down for people, like the first couple of chapters, the first two chapters of the book is just a little bit of pain education. So someone, when they start to read the book, they understand, okay, here's what pain's about. Thank you for this information. I thought pain meant that my joints were damaged. I really understand that the nervous system and the mind had such an impact on everything that's going on here. And then it takes them kind of on a step-by-step protocol with regard to how they can use ACT and mindfulness and values-based approaches to overcome chronic pain.
Okay, very good. So as someone who has a long history in meditation, I was really excited to hear that, mindfulness is being incorporated, or some sort of, looking inward is being incorporated with, approaches to, pain relief and dealing with pain. But as I mentioned before we hit record, my meditation practice really didn't incorporate a lot of what I've learned more recently is like traditional mindfulness practice. We can explain more to the listeners that this is not a religious thing in any way. It's really a mental thing. It's working with the mind, and it doesn't have anything to do with religion, as far as the way that mindfulness can be practiced, and why it's practiced around the world by so many with different religious beliefs, with phenomenal results, if you will, in different aspects of life. But as I said, I just recently got into like a true mindfulness practice. And in the beginning, and this is right around when you reached out, and I was thinking, mindfulness for pain. It's like, that's weird because I actually have chronic pain, an old hernia that I was misdiagnosed, and now it's been like 15 plus years. And I'm like, because of what I know about science, it's like getting this fixed, probably not going to necessarily have a high chance of changing anything. So, but it's manageable and low level enough. But as I got into this mindfulness practice, and where in the beginning, at least, it's very much you're focusing on sensation, the breath, the sensations in the body, noises, whatever. And I found that it actually, initially for me, I kind of elevated my awareness of the pain. It's like I gotten over time used to kind of ignoring it. And now I'm doing every morning this mindfulness and checking in with my body and focusing on sensations. And it's like, there's that pain. So I doubt I'm the first person that's kind of brought that up, or, and I've gotten a little bit into the practice where I can kind of answer my own question, but I'd love to hear, your response to that kind of initial, hey, well, how is focusing in on the body and the sensations, the pain sensations we're having, ultimately helpful in getting someone to a state where they can manage it better?
Yeah, it's a great question, Jarod. It's a big topic. I'll try to approach it from a couple of different perspectives. Maybe from like a traditional mindfulness perspective, and I'll kind of bring in maybe some of the neuroscience. So a traditional, like, contemplative Buddhist practice, if you will tell you that everything in life is transitory, which basically means that nothing is stable, everything is always changing. And we can look at that. You and I can look at this. Okay, yep. I get older, I change. My knowledge changes, like my learning history changes. So things I learned in the past are with me, and new things are with me. The weather changes. PT education changes. So the world is constantly in flux, right? Along with that, so are our thoughts. So as much as we want to try to control or eliminate or stop our flow of thinking, you have a wonderful mind or brain, so to speak, that does exactly what it's doing. It thinks. And the average person probably has about somewhere around 10,000 thoughts a day. And most of those thoughts are actually negative thoughts. Now, that concerns people sometimes, but the reason why they're negative is because it really is taken from an evolutionary perspective, that your brain and your mind, I'll use those words interchangeably throughout the episode today, was meant to pay attention to your environment and make sure you're safe. So it was constantly problem solving with regard to how do I keep you protected and how do I keep you safe from harm and danger, whether that's a saber-toothed tiger or whether that's like the tribe coming over the hill with a spear, so to speak. Now, in the modern day world, we don't have those physical dangers anymore necessarily. Most of us don't encounter, tribes and animals that will, eat us alive, but we have lots of stress in our life. And that stress mostly focuses around our mind and our thoughts. And not only our mind and thoughts, but cognitions are embodied. In essence, your thoughts have an impact on how you feel, meaning how your physical body feels. Pain is interesting because when you look at the psychology of pain, and I'll talk both about positive psychological factors as well as negative psychological factors. So let's talk about the negative psychological factors first. The one that has kind of the most traction in the literature is what's called pain catastrophizing, which means when I'm in pain, I constantly think about pain. So again, completely normal actually. Your mind is doing what your mind is doing. It's trying to solve a problem. Here's the problem. The problem is pain. And how do I eliminate this, stop it, or avoid this pain? Now, with chronic pain, that's adaptable. I'm sorry, with acute pain, that's adaptable. But with chronic pain, that's not adaptable because with chronic pain, it's less about the tissues of your body and more about what's happening in your nervous system, more about having a sensitized nervous system. The more negative thoughts you have and the more those thoughts ruminate and turn over, the more likely it is to impact your body. We know that negative thoughts create inflammation in your body. We know negative thoughts create muscle tension and tightness. And negative thoughts have an impact on your behavior, as we mentioned before, so you won't engage in activities. Now, if we can't change our thoughts, just like we really don't have a good way to change chronic pain, some of the best research, and these are where acceptance and mindfulness approaches come in, is there a way for me to turn toward this in a way that's healthy? Can I start to look at my pain and distress? And I'll really, when I say pain, Jarod, at this point in my career, I really use physical and emotional pain. It's just one. The distinction between them is really only a construct that we've invented in our minds. There's really little difference between physical pain and the various emotional pain that we all struggle with. So if I can't prevent that, right, how do I turn to it? And how do I build resiliency so that I can live my life even with a little bit of pain, let's say? Now, that's important, of course, for our patients, because if we don't have wonderful, like wave the magic wand ways to alleviate pain, which we don't, then how can I teach people the skills, both the cognitive and behavioral skills that they need to, let's say, let their pain be with them, let the pain be present, but still move forward in life and do the activities that are meaningful or the activities that bring them purpose in life? So the resilience part is the positive psychological aspect. So that involves, your own self-efficacy, your own acceptance of things that are uncomfortable in life, your own awareness of what's happening, and then finally, what is your purpose in life? What are your values, and how does that impact you? And what the literature shows, and this is the same in clinical practice, when you focus on the more positive psychological factors, self-efficacy, awareness, acceptance, values-based living, that all of that in many ways is rewarding, right? So if you live your life based on your values, it's rewarding. Now, what does that mean on like a neurophysiologic level? It means, well, I have a reward center in my brain, right? When I engage in activities that are meaningful to me, my brain rewards me with feel-good chemicals. And that, as I mentioned before, that extends to people living with pain. And it even extends to, practitioners as well who are dealing with things like, burnout and job stress, which is so important and so prevalent in every area of healthcare, especially physical therapy.
Okay. Wow.
Sorry if that was a long-winded response, Jarod.
So the idea, kind of back to what I had stated about like focusing inward, and you saying, if we can get them to be with the pain and, in a productive way, I can't remember if I said productive, but in a beneficial way of some sort. What does that look like as far, could we get some details on the kinds of things that you're guiding patients to do when it comes to like a behavioral cognitive therapy or specific to mindfulness?
Yeah, so sometimes like when I say cognitive behavioral therapy to especially physical therapists, they kind of, get a little like, cautious, like we're overstepping our, scope of practice. So this is completely within our scope of practice. We're not doing psychotherapy, right? we're using basic cognitive behavioral skills and techniques to guide our care to help people with pain. So ultimately, what we're talking about is psychologically informed physical therapy, which has been in the literature for a very, very, very long time. Where you start with people with pain is really this. People with pain understand that they're having emotional challenges around pain, not just physical. They're well aware that they're anxious. They're well aware that they're depressed. They're well aware that they have stress around pain. What no one really has talked to them about is how their mind works and how that impacts their pain. So we can do a couple of these things here together, Jarod. So for example, your mind thinks thoughts all day long. It's completely normal, right? As I said before. And it's important to normalize that with your patients. What we don't have a good way to do is shut off our thoughts about pain specifically. So the way you can teach this to people real simply to kind of, teach them this skill, so to speak, is I'd like you to think about a time in your life that was really happy for you. And just let me know when you have that, Jarod.
Okay.
Okay. And then what I want you to do with that thought or that image, whatever it comes up as, is I want you to try to delete it from your mind. So with all your skills and all your might, try to delete that thought from your mind.
Okay.
And let me know if you're able to do that.
Delete the memory or just stop thinking about that thing?
Delete the memory. Yep.
Well, can't do that.
Right. Can't do that, right? So we can't really delete memories. Bring up something in your life that is not really, stressful, but maybe just moderately stressful, like the morning commute, like that stoplight that's always packed with people, something like that, right? So bring that to mind, that memory, that image, right? So that's something that's unpleasant, and see if you can delete that from your mind.
Yeah, I mean, that's, if it's not a stuck memory, so to speak, it's just like an ongoing irritant, I can think of other things for sure.
Yeah, but that's present too. You can't delete it though, right?
Well, I guess I'm not fully understanding. When you say delete, do you mean like it's exiting from your memory completely, or that you can just think of something else?
Exiting from your memory completely. Yeah.
You better remember.
Right.
Although I forget plenty of things, but
and it's a good question you asked. Are you telling me to? Because what you're essentially were asking the second part is there a way for me to effectively distract from something that's unpleasant?
Yeah.
So I don't want to think about that morning traffic that I sit in for an hour every day on the LA freeway. How do I distract from that? And there are ways. Healthy distraction has its place. But if I asked you, let's say, to think about a pink monkey, and now I want you to try to block out that memory from your mind. So don't think about a pink monkey. And I'll give you 10 seconds not to think about a pink monkey.
It's probably, even for a meditator, almost impossible.
That's right.
Like at some point in that short, it's like you're going to think of it.
That's right.
Yeah.
Now, these are just kind of simple, playful ways that we work with patients like this. We can start to broach these conversations on how to use cognitive and mental skills training, which is really what we're talking about in PT practice. Now, I do work with my patients and, we start to move toward things that are more unpleasant for them. Like, do you have an image of a herniated disc pressing on the nerve in your lower back? Is that what's persistently there? Because if that's the image, and we can't change or delete images or memories, which we can't, really good psychological and neurocognitive research that we can't change memories and thoughts.
Cannot.
Yeah. Cannot, right. Then how can I be with those memories and thoughts and still engage with some of the activities I'd like to engage with and lead a productive life? So let's just kind of start you mentioned, how do we start to talk about these things? You don't start to talk about them in pain necessarily, but you start to talk about other aspects of people's living, and then you move toward their pain. And ultimately what mindfulness tells you is once you start to bring your attention toward things that are painful, you actually notice that pain is not constant. That pain actually changes. Mm-hmm. So when you first sit in meditation, that knee pain may feel like a 5 out of 10, and then it shoots up to like an 8 or a 9. You just want to wiggle and get out of that seated position. And then over time, as you stay with it, and you notice your breath and you notice your thoughts and you notice your 5 senses, and you come back to the sense in your body, that sometimes it goes completely.
Mhm.
And there's a pretty good chance it'll come back as well. Just like with some of the unpleasant thoughts in our life, like many of us have, everyone actually, everyone on this planet has some type of negative self-judgment about themselves that continually comes up. We all have them. They probably started early in life. So if I can't change that self-judgment about myself, how do I at least learn some skills to be with that, but not let it impact me in a way that's negative?
Mhm. Something I just realized we didn't really do early on for those that, and even for myself, again, like just getting into true mindfulness practice just recently, I think I had a incorrect definition leading up to that
Yeah.
point. So, how do you define mindfulness?
I mean, to really just put simply, because there's so many like long explanations of mindfulness, depending on whose literature you're reading. But mindfulness is just simply a state of being aware non-judgmentally. That's really all mindfulness is being aware in the present moment and taking a non-judgmental stance toward whatever's happening in that moment. The non-judgmental stance is probably the most important part of all of that.
Mhm.
Because if you're present in the moment with pain, except everything with regard to your thoughts about that pain is how can I control it? How can I eliminate it? How can I stop it? Then that's not a non judgmental stance. And with that, you wind up in that kind of circle of pain where you think about pain, pain gets worse. Think about pain more, pain gets worse. So that's a simple explanation of what mindfulness is and how it impacts chronic pain.
So that leads me to another question of how do you how do you train someone, I'm sure over time, to decrease their judgment and putting a negative connotation or label mentally on their pain, because obviously pain, it's so emotionally charged for so many of our patients. I mean, yeah, I mean, it's like the idea of taking someone who's not aware of any of this stuff, mindfulness stuff, whatever, and leading them from kind of that starting point to a point where they actually are not, or I should say, maybe not, completely not, but they are putting far less of a negative label and connotation and judgment on their pain. Like, what does that process look like? How do you help people to get there?
So the technical way to look at that is there's three parts of mindfulness that help people. The first is emotional regulation or emotion regulation. The second is attention control. And the third is self awareness. So when you go into the mindfulness literature and you ask, how does this help people? Those are really the three main ways it helps people. We can kind of break those down a little bit. So emotion regulation is when I feel pain, fear kicks in right away, right? So fear is an emotion. Mindfulness teaches you how to kind of anchor in the present moment, to notice that there's not only fear, but there's other aspects of your experience at a present. And then in many ways, you become the observer of your own experience. And it's kind of like a little more technical mindfulness neuroscience. So in mindfulness, we talk about what's called metacognition. Metacognition is just a really fancy way of saying, I am thinking about my own thinking, or I'm thinking about my own emotions. So instead of kind of being wrapped up in your own emotions, right, you almost learn, you learn how to take what's called an observer perspective, where it's not that I'm necessarily feeling and thinking my thoughts, but I can actually somehow distance myself from my current experience and be the observer of what's happening in my life currently. And what's nice about this, it's a really safe place for people because the observer perspective doesn't change. It's been with you for your entire life. It's kind of how you see yourself through your eyes, so to speak, but you're a little distance from your own experience. So if you can't change pain, and you can't change unpleasant emotions because there are things in your life that are uncomfortable and unpleasant. How do I find this safe place, so to speak, safe both physically and safe emotionally as well, where I can be an observer of what's happening and take that non-judgmental stance? So it's very difficult, Jarod, to take that stance when you're wrapped up
Mhm.
in the moment. So that metacognitive process or that thinking about your own thinking allows you to create some space from your thoughts. So that's emotion. Emotion regulation is wrapped up in that. Attention control is okay. Let's say I have chronic low back pain and I'm a physical therapist. How am I able to go to work and focus my attention on the patient and the job I have to do in that present moment instead of focusing my attention on my pain? So you have the ability to regulate your own attention. And then finally, all of it, relates to self-awareness. So am I aware in those moments when my brain kind of hooks me or my mind kind of hooks me and drags me off into the future? And I'm saying to myself, oh, maybe I should go to the doctor and get this disc checked out. Maybe it's pushing on a nerve. Maybe I need an injection. Maybe I need surgery. And if I have surgery, I'm going to have to take off. And who's going to feed my kids? And I'm going to have, the mind just starts off with these stories, basically. So having the awareness that you're hooked and bringing you back to that present moment, that's the third part of it with regard to self-awareness. So those are the three parts of mindfulness and how they help with pain. And in general, how they help all the different physical as well as mental conditions that they've been studied with.
Yeah, it's been really cool to see finally some science, looking at the brainwaves of the great meditators, and it's really fascinating stuff. And through the years with my teacher, these kinds of statements that were, I guess, kind of focused on, in Buddhism, more of the traditions. And again, this is not about religion, but more of the traditions and the practices that are more mindfulness-based practices, is that idea of gaining space in the mind so that as the thought or the emotion comes up, you don't immediately act on it, that you can actually just observe it for what it is without judgment and then watch it fade away. And you often use the analogy of, like, most people are like one of those big oxes with like the nose ring, with that's like got the rope through it. Just your emotions basically have a hold of that nose ring, and you're just constantly yanked in any direction that it pulls you without any control. And that a practice like this gives you just that split second or the few seconds that it takes to recognize, okay, I'm not going to go down that path. It's not able to yank on you and take you there.
That's right. So in that awareness that you're mentioning, there's some space there where instead of reacting, you can choose how you want to respond. A really simple way to start to work with patients, because there's two things I want to dispel. The first is one, that mindfulness is not evidence-based. It's an extremely evidence-based way to help people with all types of different things we're talking about. The second thing is that there's lots of different types of mindfulness. If you're engaging in mindfulness that is promising to stop your thoughts, stop the flow of thoughts, change thoughts, stop emotions, all that stuff, that's not evidence-based. That's not what mindfulness is about. Mindfulness is actually being with whatever is present in the moment. But just a really easy exercise everyone can do is just an acronym called STOP, which literally is stop, take a breath, observe what you notice or observe what you're observing, and then proceed. So it's that ability to start to, how do I create that space where instead of reacting, which is like a gut reaction, right? Almost like a reflex, how do I respond in a way that's more effective? Because oftentimes reacting is not healthy. Reacting is kind of that gut instinct, more primal, where responding brings a lot more cognitive higher centers into the equation.
And I imagine, I could be wrong, but in my own experience, just sitting down for a short meditation in the morning, and then kind of going about the rest of the day with my monkey mind is not nearly as effective as sitting down for maybe even a shorter meditation in the morning, and then multiple times throughout the day having like a quick moment of something like this stop strategy. So do you, with your patients, when you're teaching them these things, are you kind of having them set a reminder to just do a quick mental practice throughout the day so it really becomes a habit?
That's right. So this is where we start talking about, okay, how do we take mindfulness, which typically does not have a behavioral component to it, a behavior change component, right? Because most traditional mindfulness, okay, sit down and just think about your thoughts, and then go about your day? How do we take it and use it in a way to help people with their behavior? So stop is one, just a simple exercise, and then teaching people to implement mindfulness throughout all parts of their day. And there's lots of different ways to do that. Everything from savoring pleasant experiences. Oftentimes, people don't take the moments that we have in life to savor. And that savoring is really important with regard to generating positive emotions and feeling good, as well as learning how to deal with the unpleasant moments, which will come up in life as well, right? So how do I bring mindfulness into the unpleasant aspects of my life? So yeah, connecting with people about, okay, what's happening today? What are you doing today? What does your day look like? You going to work? After work, you're gonna, I don't know, go to the gym and then watch a movie, take care of your kids, see your boyfriend. How do you work some mindfulness into, where are the opportunities in your day to work mindfulness in? And when you do that, that's when you start to change behavior. There's another important part of mindfulness that does exist in some like traditional mindfulness approaches, and that's training on intention. So helping people set intentions for the day and helping them see those intentions through. Because when you react to things instead of responding to things, those reactive moments pull you away from the day you intended to have. So you may start your day with, let's say, a 5-minute meditation just based on what your intentions are for that day. And then as you develop mindfulness throughout the day, how do you keep returning back to your awareness of, okay, am I living this day? Am I living today based on the intentions I set early this morning? And why this is so important, I think, for PT practice is because the science on mindfulness is not that you have to sit for 40 minutes, in a cross-legged position and chant for hours on end. That really just somewhere between 3 and 10 minutes is where we see like the cognitive changes start to happen on functional MRIs, and where like inflammatory markers in the blood change. All that happens probably somewhere around 9 minutes. So that can fit really easily into a PT practice, and it can definitely fit really easily into your life.
Very good. Now, I don't think that you knew. Obviously, we didn't really pre-plan much of this, but I'd love to hear your thoughts on the use of these techniques. Maybe what you just mentioned, a short meditation and something throughout the day of incorporating a stop practice or something like it. How would you foresee that could be helpful for folks who have had a very stressful 2020 and 2021? Some would say they feel like it's looking up. Others would say they wouldn't. Who knows? It's in the future. But, ultimately, our experience is based on our mentality, what's going on in our mind, right? So whether or not you experienced 2020 as a terrible year or an amazing year had actually less to do than you think with outer conditions and pandemic stuff and all that, and actually how your mind is functioning. So with that, I think we can both agree on that. I don't know if everyone else will, but with that kind of foundation, what might you give as like a strategy for the listeners themselves? Pain, all the pain stuff aside, or its effect on pain, but just like on a day-to-day basis, how could someone listening incorporate some of this into their day to bring greater happiness into their life?
With regard to 2020, so to speak.
Well, just in general, it's like, regardless of what's happening in the outside world or in your life, how could these strategies, or could you maybe provide something that you would, instruct someone who's dealing with tough times to use throughout the day, or maybe at the beginning of the day, like just something actionable for people who maybe are, life is not going and business is not going exactly as they'd like right now as they hear this or moving forward?
When I reflect back on 2020, it's a great question, Jarod. When I reflect back on 2020 and I look at my own distress as well as the distress of, my loved ones and people around me, and then the profession, there's just so much unknown, right? We have some more information now with a vaccine, but even that, to a certain extent, is still unknown. And it kind of takes us full circle to the beginning of our conversation, is that life is constantly in flux. Everything's constantly changing. And the truth is, as much as we, especially as professionals, I believe, as much as we feel like we have solutions and we have control over things, there's really very little we have control over. If you can come to that place where you realize there's very little you have control over, um, some people may not like this, but there's actually a surrender that happens there. So I'm no longer struggling with what's happening, how do I solve it, what do I have to do, et cetera, right? In that surrender, there's peace. There's moments of peace. Now, that surrender is not necessarily a place you arrive at and you're there, forever, and it becomes nirvana. That's not it. It's with mindfulness, you learn how to come back to that place where, okay, I have to go to work and I have to wear a mask for 8 hours out of the day, which I haven't been doing before, which as health professionals, we knew when we entered into this profession, there was a chance that could actually happen, right? Okay, well, how do you surrender to the idea that you have to enter into a workplace where you potentially could catch a deadly virus or a virus that impacts your health for the rest of your life? And really with that, it goes back to a couple other aspects, Jarod. When you train in mindfulness, it improves your empathy, it improves your compassion, and it improves your ability to help other people or your perspective of what other people are going through. And I think the perspective taking aspect that develops with mindfulness is something that we desperately need in pain care. I think it's really hard for us to imagine what it's like for someone who's been struggling with, let's say, fibromyalgia for 10 years. Like, we know it didactically, like textbook wise, we get it, but I don't really understand what their experience is like. So being mindful gives me a way into what they're experiencing. If I can feel or tap into what they're experiencing, I can help them, more effectively. And then if you take that into like the broader perspective of society, it's like we have whole parts of society that have been really struggling during the time of coronavirus. Some of it's financial, some of it's with regard to their health, and some of it's with regard to race. There's so many different levels to it. So mindfulness helps with the compassion aspect, helps with the perspective taking aspect of it. So there are mindfulness exercises you can do, for example, with before you see your patient in the clinic, where let's say go into the office and you say to yourself, okay, before I go out and see Judy today, who's had 3 hip replacements, they've had all revisions, it's been hard for her. What is Judy thinking in her mind? What is Judy feeling in her body? And what does Judy need from me today as a professional? So these are things that we're not really trained to do in PT school. We're very mechanical in lots of different ways. So these are ways you can bring mindfulness into your clinic to help, in essence, with that therapeutic relationship and just helping the single person. And then from there, obviously, we hope that people help other people, and that's ultimately why we're here and what we do. And you can even bring some of that. What's interesting, Jarod, is as people learn to be mindful and they learn mindfulness, they become kind of advocates automatically. Mm-hmm. And they start to tell their friends and their family, and they talk about it on podcasts and wonder, why is mindfulness not part of all of our lives? Or why is mindfulness not part of our profession, so to speak, where people are suffering? Yeah. So kind of a long question, but I really think it relates ultimately back to perspective taking. And can I take the perspective of someone else during a tragedy, at the same time protect myself and take care of myself with what's happening? It's kind of like that, putting your own mask on first before you put someone else's mask on. Mm-hmm. So if you're mindful and you have these skills, then you can better help your patients and help the people around you that you care about.
Right on. And so tell us a little bit about where we can find the book and kind of who the who's kind of the ideal audience, who's going to get the most out of this book that's coming out January 2021.
Yeah, so the book is called Radical Relief: A Guide to Overcome Chronic Pain. You can find it on Amazon in most countries. So the book, It's a workbook in essence. My first book was like a large 350-page book. I learned a lot from that, that when people read books, both people with pain as well as professionals, that they want something that's a little bit more approachable and more useful. So this is a workbook. It's only 100 pages. It's got 35 chapters. And each chapter, at the end of each chapter, there are cognitive or mental skills training exercises that you can do. And ultimately, the book takes you on a journey from, okay, here's what's happening with pain, here's what's going on, and here's how you can use these cognitive and mental skills training to change your pain and improve your life. So it's written both for people with pain as well as practitioners. The nice part about it for practitioners is they can pick up any chapter. Let's say each chapter is only about 2 or 3 pages, so they're really short. And that chapter can, in essence, become your intervention or your exercise for that day working with your patients. So,
Cool.
um, designed it to be simple and easy and approachable.
Awesome. Awesome. So find it on Amazon. You said it's Radical Relief.
Yeah, it's called Radical Relief, A Guide to Overcome Chronic Pain.
Very good. I've got a handful of patients in mind that I want to learn for, and maybe suggest they check it out as well. So before we wrap up, is there anything, on this topic that we didn't really dive into, that, because I know you're really big on educating not just people in pain, but also our fellow colleagues. Is there anything we didn't touch on that you feel like would be important to bring up, or do you feel like we kind of hit the top points?
No, there's something important I think we should share with colleagues. And I know you share this as well, Jarod, because you've been a meditator for a long time and you've seen how mindfulness has impacted your life. I did mention this briefly a couple moments ago. We kind of go through as physical therapists, we go through a particular type of training where in essence, we're actually told that we have the ability to alleviate someone's pain. And we do for a lot of different types of conditions. There's also a lot of different types of conditions that we don't have that ability to alleviate someone's pain. However, I believe it weighs heavy on a lot of professionals and they take that home with them. And that's when burnout and stress and anxiety happen. So I know you talk a lot about, let's say, key performance indicators in your practice, right? How do you measure the health of your practice? One of the things we have never been taught as professionals is how do we measure our own personal key performance indicators? So how can you reflect on your own stress? How can you reflect and improve on your own anxiety, sleep, relationships, your own habits, let's say the unhealthy avoidance habits that you've gotten into to avoid the unpleasant things that are happening in your life, whether that's drinking too much or watching TV or getting lost in social media. We all have them at times. So what's great about mindfulness is it starts to make you think about your own key performance indicators. And through training mindfulness, you realize, okay, mindfulness is helping me with anxiety. It's helping me sleep better. I realize that I'm not spending time with my spouse and giving them the quality time that's necessary. And I really firmly believe, just being through my own kind of business expansion, that your personal key performance indicators have an impact on your business key performance indicators. And they're intimately intertwined. And I think when people learn mindfulness skills, they not only help you in business. We know that many CEOs of Fortune 500 companies, probably about half of them, all now study mindfulness. So it's something that can impact your PT practice as well as impact your patients with chronic pain, which is why I'm so passionate to talk about it with you today.
Right. And then, for those who want to get into a practice, or just, maybe test the waters, get started, try a meditation out, get some guidance, what, aside from the book, which is a little more focused on pain, but for a mindfulness practice itself, I have my own that I, like to suggest, but I'd love to hear when someone says, I'd like to try that out. Where do you start them?
I ideally in the ideal world, I try to start them with like a live meditation. So actually sitting down with a meditation instructor or another professional who understands meditation, who can explain what meditation is about first, take them through a guided meditation. And the most important part when you're initially training in meditation is the debrief after. So what happened during those 10 minutes when your eyes were closed? What did you notice? What came up? How did you react to it? How did you respond to it? Those are the most important parts, that debrief part. I think it's Meditation apps are wonderful, things like Headspace, so you can go there, but you kind of put the headphones on. In some ways, you distract yourself for a couple moments, but there's not that reflection process, that debriefing that happens after, and that's oftentimes the most important part. So, if you can find a meditation teacher or a mindfulness teacher in your area where you can take classes and have a conversation with them, that's really a great place to start. And then I have a program coming out called Mindfulness-Based Pain Relief, which is how to use mindfulness specifically for chronic pain. And it gives people a pretty good idea and a debrief of what happens in the mind of the meditator.
Great. That's coming up. It's not available right now.
It'll be available by the time this is probably broadcast.
Okay, great. And then, aside from the book, where can people connect with you? What's the best website or social handle?
Yes, all my social handles are pretty easy. It's at Dr. Joe Tatta, and then you can find me on the website, which is the Integrative Pain Science Institute.com.
Integrative Pain Science Institute.com, and then it's Tatta.
Yep. Joe Tatta, Tatta.
Great. Well, I'll let you get back to your Italian in-laws that you said were waiting for your attention. Thank you so much. This has been great. I hope that it, opens the eyes of at least a few out there in a way that they can, be of greater help to so many of our patients who, like you said, they do have either big components or fully are dealing with pain that go beyond what we're going to be able to change with our hands. And so I really appreciate this. And I know for the listeners out there, this wasn't necessarily business focused, but as you'd mentioned, before, having these techniques for your patients is certainly going to be good for business, but also maybe having these techniques for yourself and your own, improving your own KPIs are going to help with the business KPIs. So thank you for all the above. I really appreciate it.
Thanks, Jarod. It's been great chatting with you today.
Thanks for listening to this episode of the Cash-Based Practice Podcast. If you liked what you heard here today, we have some extremely important things we want to send you. First, a quick start guide to cash-based physical therapy and Medicare. This free ebook will provide the primary rules and regulations surrounding this confusing but important topic. Secondly, we want to share with you the 5 characteristics common to all successful cash-based practices. Find out the vital things Jarod has learned from years of interviewing cash practice owners and running his own successful cash practice. As one of our listeners, we want to give you all this information absolutely free. You can get it right now by going to drjarodcarter.com/success. Again, that's drjarodcarter.com/success. Go there now to get your copies, and we'll see you next time.